All right, well, welcome to the continuation of the 2021 National Conference for the Amputee Coalition. I'm Victoria Powell. I'm a registered nurse, life care planner, case manager, and legal nurse consultant. And I'm here today to talk about advocacy specifically. If you've been around the AC at all, you know that advocacy is a big part of the outlook, the mission and goal of the Amputee Coalition. And that's everything from making a voice on the Hill so that we can get legislators to do what we need them to do for the Amputee Coalition, for the amputee population. But today I'm going to talk about a little bit different type of advocacy. This is self-advocacy, or the art of speaking up. I wanted to start with this clock. One of the things that happens in my role is, as a case manager, I actually attend physician appointments, prosthetist appointments, different therapies and so forth with my clients. And what we find is that there is very little time actually spent one-on-one with your treatment providers. And that's just the way of our healthcare system as it stands today. In order to make money, the providers have to move patients through quickly. There's a lot of paperwork to be done and a lot of things that happen behind the scenes. But because of that, the time that we spend face-to-face with our providers is very limited. So it's important that we make the most out of that time and that we spend it doing what's important to us. One of the problems that we have, one of the problems that we have is passivity. And that is the fact that we are passive about what happens. We do not necessarily speak our minds. Oh my goodness gracious. Please forgive me. It looks like there's a little timer going on here, and I don't know why it's doing that, but we are passive. We let someone else tell us what is important to us. And that's just not the way things should go. 86% of people believe that disagreeing with a doctor or a provider's advice is unacceptable, or for somehow it would make them less than. But that's a mistake, and we don't want to make that mistake. It's more important that we actually communicate what's important to us. So what is self-advocacy? Let me just bebop out of this for just a second and see if I can turn those off. I do not know why those transitions are there, and I so apologize. You guys do have a chance to put questions in the chat box. So if there's anything in particular that you want me to discuss today, if you'll put those in the chat box, we will make sure that we get to those. I don't know if I fixed it or not, but we'll see. Apparently not. Okay, so we'll just try this the best I can. You do have a copy of these slides in the materials that you've been, oh my word. Oh, this is not my day. Okay, one more time. So what is self-advocacy? Advocacy is about speaking up for yourself. It's about staying informed on what's important to you and how to get that information. We also have to know our rights and responsibilities. We're not the passive person in this equation. We're actually the primary purpose. We need to find others who can support us. Sometimes that means that you can find a friend or a family member. Sometimes you have to do it for yourself. It's also about solving problems and finding where you can get help when you need it. Really and truly, if it all boils down to taking control of your own life and being what we call having self-determination. So what can an advocate do? So when I think about an advocate, obviously an advocate is someone who's speaking up for you or for yourself. In my role as a case manager, one of the things that I do going into the provider's office is I listen to that client throughout the month, and I know what it is that they are struggling with. And so when we get to that provider's appointment, the very thing that I do is take those questions or concerns that were voiced throughout the month, and I bring them to the provider. I'm also an extra set of ears. Because that time face-to-face with that provider is so limited, it's very difficult to listen and actually take in and process the information that's being given to you in these short visits. So being an extra set of ears allows someone else to pick up on nuances maybe that you didn't get the first time. Another thing an advocate can do is to compile or update a medication list and look at your medication regimen. How do you actually take the medication? And I'll give you an example of why this is so important. Knowing the name brand as well as the generic brand of a medication is very important, and to know what the medications are actually used for. My grandmother has a thyroid problem, and she takes thyroid medication. So one of her medications was called Synthroid. Had another bottle of medication called levothyroxine. They had different dosages on them. She thought they were different medications, where one is actually the brand name of another. And when the doctor changed her medication, she failed to realize that there were two separate medications, that they were the same medication in two separate dosages. And she was overtaking medication that she should not have been taking. So it's very important to know exactly what the medication is, what the generic name of it is, who the prescriber is, what condition it's supposed to be treating, and what kinds of side effects you might see from that. Advocates can also do things like help you find transportation or look at research options. We fill out paperwork. We assist in all kinds of insurance matters. We also help you to determine what is the big picture. For example, if this test that you're recommending is negative, what's my next step? Or if it's positive, does that mean I have to have surgery, or is there another test that comes after that? And an advocate can also be part of your support system. So when is it most important? For me, one of the things that we get called in for the most is that a patient has undergone a series of tests. They're worried about the diagnosis. Sometimes it's a fearful diagnosis, such as cancer. You might want to bring someone with you to hear and discuss the results of your tests. Or if you've been diagnosed with a serious injury or life-altering event or illness, maybe you have a lot of paperwork to file. Maybe it's paperwork for reimbursement or Family Medical Leave Act, or understanding nursing home options for one, even during a power of attorney. The older you are, the more important it is to have another person with you during the visit. As you age, you tend to have more health issues to us than you did when you were sign of our aging. So what is a sign of a great advocate? One thing is that the advocate should be calm and have a good attention to detail and be a clear communicator. You want someone who can speak up for you for the way you feel, not to use their own words, but rather to share what's important to you. In order to be your own best advocate, you want to start with building your medical team. And that's everything: your doctor, your prosthetist, therapy and occupational therapist, any counselor, psychiatrist, physical and rehab doctors. Those are all part of your team. So if you build your team, that means picking people that your best interest in and making sure that they communicate with one another. In order to get them to communicate one another, an important way that you can do that is by creating a healthcare journal. And we'll talk more about exactly what the journal should have in a few slides from now. You also should know your resources. In this particular case, if we're talking about amputation injury, knowing that you can find help at the Amputee Coalition in the National Limb Loss Resource Center, you can hire professional patient advocates, you can talk with peer counselors. All of those persons can help you to create your biggest batch of resources to call upon. And then when you navigate your appointments, we want to make a list ahead of time and bring a friend or another advocate. We want to ask questions, and that means writing those questions in advance. We want to make sure that we get clarification for anything that's being addressed and that we keep records of those visits or can obtain records through the portal. A good patient-provider relationship is absolutely a partnership. This goes back to that passivity I talked about previously. We don't want to simply be the passive party and take whatever is dished out to us and just go with it as if that's the only option. Instead, we want to develop a partnership. There should be two-way communication between us and our providers. And if we take that active role, we can have a significantly decrease in the chances of medical errors. And that's a huge thing in the hospitals in transitions of care. What I mean by that is if you're in the hospital and you move to a rehab facility, and then you go from the rehab facility to a home therapy, and then from home therapy, maybe you go to outpatient therapy. Each one of those changes in treatment is a transition of care, and the providers that are on the team at each of those facilities or each of those types of providers needs to be aware of what's important to you and where you've come from and where you're going and what your primary focus is. Whatever you do, you cannot be afraid to say what's important to you, how you want to be treated, what you understand or don't understand, or what you're worried about. Our providers, and that includes myself as well, we get used to taking care of patients with a particular injury, illness, or condition. We hear the same types of questions because primarily patients, as a general rule, have pretty much the same type of concerns when they have this new diagnosis. So we tend to give the information that we hear questioned over and over, and we assume, wrongfully, but we assume that we've answered the appropriate questions, that we've addressed the important things for you to know. But unless you tell us what's missing or what you don't understand, we don't know to go further. I have some providers who are really great at drawing pictures. Some people are auditory learners. Some people are visual learners, and others learn by doing. So it's important that if you don't understand, that you mention that you don't understand and give the provider an opportunity to provide new ways to provide the information for you. It's also important that you let your team member know exactly what your goals are so that you can make decisions about your care. To give you an example, I love CrossFit. That's what I do every morning. It's my stress relief, it's my anxiety relief, and it's important to my health. I had a shoulder injury and I underwent a lot of conservative treatment because what it was important to me was not having surgery. I wanted to avoid surgery at all costs. But it was also important for me to go back to CrossFit and be able to get on the rig again. So in order for me to do that, after a year of conservative treatment, it was found that pretty much the only option I was going to have was to go into surgery. So the primary question that I had for my surgeon was, if I have this surgery, what are my odds of being able to return to CrossFit? What are my odds of being able to get back on the rig? I could have dealt with the pain. It wouldn't have been fun, but I could have dealt with the pain if I had to. But what was more important to me was, can I go back to the life that I want to live? And I had to share that with my provider so that we could make the best decision for the type of surgery that was recommended, when, and what my rehab was going to look like. When you choose a physician, you want to make sure that your physician is board certified, that they have an appropriate background or specialty, and most important, they're a good listener and they're respectful. One of my husband recently just underwent cardiac bypass surgery, and they warned us that his physician did not have a very good bedside manner. While he was going to go under surgery, to me at that point, it was more important to have an excellent surgeon than it was to have somebody who had a great bedside manner. However, if I was going to avoid surgery and I wanted to make sure I had the best physician for me to be able to communicate with, it would be more important to have a good listener at that point. So sometimes those options are going to weigh heavier on one end than another. When you talk with your doctor, you want to ask certain questions. And I've given you some examples here as some things that you might want to consider, such as, where can I find more information? Or has my situation changed since the last appointment? If I do this treatment, what can we expect? If I don't do this treatment, what would occur? What kind of changes do you expect in 3 months, 6 months, or a year? What are the next steps in my procedure or my diagnosis? And these are just some questions for thought, if you would. Similar situation when we talk about a prosthetist. We want to make sure that we have a prosthetist that has the experience with the level of amputation that we are experiencing, or the limb loss that we are experiencing. What options do they offer? How are they familiar with some of the new techniques out there? Do they work with a particular surgeon who knows about things like TMR or osseointegration or myoelectric devices? Are they associated with my insurance carrier? Do they provide device trials? And you may not be aware of that, but many of the providers do allow trial basis prosthesis use or trials, if you would, to determine if that's appropriate for you. I've even seen where a particular device was not authorized by an insurance carrier, but the prosthetist allowed a trial and was able to document the difference in what an individual could do with that device versus the one that the insurance company would allow. And it has allowed us to bypass their system and get coverage for devices that would not otherwise be covered. Just like in the provider questions for the physician, I've given you some examples for your prosthetist. For example, if you have an upper limb loss, you really want to make sure that your prosthetist has experience in upper limb loss. And there's a smaller percentage of those who have upper limb loss in correlation with those with lower extremity loss. So it's important to know that they have experience there. Ask them if they have therapists that they work with or that are knowledgeable about this specific types of prosthetic devices. How long does it take to get into an appointment? If my prosthesis breaks outside of work hours, what's your protocol? How many options do you accept my insurance? Do you assist me with insurance claims or denials? These are all very important questions. These were developed with some other persons in the limb loss community, as well as other providers. A group of us got together that included therapists, nurses, physical medicine and rehab physicians, social workers, and so forth. And we updated the First Steps publication for the Amputee Coalition. And some of these questions were developed during that period of time. And if you do not already have the First Steps publication, I would recommend that you reach out to the Amputee Coalition and obtain that. In the back of that publication, you'll see some forms, including some of these questions. So like I said before, your prosthetist oftentimes does not have any experience with particular providers such as children or upper limb loss or some of the devices. So it's important to ask those questions. Same goes with choosing your therapist. You want to make sure that your therapist has some experience with amputees. There are very few therapists who actually work with active individuals with limb loss or limb difference. I have seen some remarkable therapists who could really think outside the box and could really get people going with their devices. But they were not the normal. They were absolutely a gem that we just discovered along the way. Some of you are around major medical centers where you have access to therapists who maybe work in a rehab center and are experienced with those with limb loss. Others are more inclined to work with a shoulder strain or sprain or a knee replacement. So it's important to know that your therapist has experience. And if they don't, ask for a recommendation. You may have to go a bit further, but this is your condition that we're talking about, your life and your ability to get around. So we put together questions for the therapist as well, like how long they've been in practice, how many patients do you see with my type of amputation? Do you have any current patients that I could speak with? Do you provide therapy before and after getting a prosthesis? And a big one is, do you communicate with the prosthetist or the physical therapist, the occupational therapist, the doctors? It's so important that everybody is on the same page and that there is communication between each provider or each team member. I cannot make this stop. When we navigate for appointments, we want to make sure that we document our journey. And we do that through the way of a healthcare journal. What is a healthcare journal? Well, a healthcare journal is nothing more than a notebook or something that we've put together that we can use to communicate with our providers. And we keep track of our own information so that we have the information at our fingertips. You can do this simply with just a notebook where you're just collecting the information. I personally like to have a multi-subject notebook so that I have tabs for different sections. Some of this information is also included in the First Steps publication. But to give you a brief summary, one of the sections should be your medications so that you always have a medication list available. As far as the notebook, I recommend a notebook that is small enough to carry in a purse or a backpack rather than a big 30-ring binder, just because you want to make it easy to go in and out of the doctor's office. Copies of your driver's license, copies of your medical card, those are all really great because you end up having to show those when you go into the physician's office anyway. So it's very helpful to have those at your fingertips. A section on your providers, name, address, and telephone number of your pharmacy, your prosthetist, your physician, and so forth is also important. You want to have a place to write your questions and have those prepared in advance. After the appointment is over with, you should ask for literature or any kind of resources, drawings, things that the provider may be able to provide to you so that you can have better understanding as to what's going on with your condition. You also want to avoid unnecessary tests. Like I said before, we talk about different transition periods where you transition from this facility to the next. Well, if you have a test at one facility and then the new facility wants to do that same test, If you already have the results and you already know what tests have been done, you can say, hey, hold up, I just had those tests done. Is it really necessary that we repeat them, at only a week later or 2 weeks later? Is it going to give us any kind of new diagnosis? And what are the benefits or risk involved in this test? Make sure that you do your own research. Do not simply Google a condition to look for that. You really want to look at reputable sites. You don't want to seek out any kind of opinion pieces, advice, or product promotion. And it's very difficult to tell the difference in some of these sites. I tend to go to major medical centers that have information on their particular areas that they have specialty areas, or things such as Medscape or these other major groups you can obtain research for. So back to the journal, your health history. This is just a general information as to what has happened to you and when, like a list of when you were diagnosed, or kind of diagnoses that you live with, such as hypertension or depression. If you have a advanced will or directive, a power of attorney, healthcare power of attorney, those things should be listed in the healthcare journal as well. I spoke earlier about medications, but that also includes allergies and your pharmacy name, address, and phone number. And then any kind of surgery dates, even if you just have the year, it's not specific that we know that it happened in the, January 14th. It's more important that we know what year that you underwent particular surgeries and what kind of outcome you've had from those. If you're discharged from the hospital or from one facility to the next, this can even be from outpatient therapies and different things. When you're actually discharged, they tend to do a discharge summary or some sort of report at the end. Ask to explain what the treatment's supposed to be done at home. How are you supposed to continue? Just because you were discharged from physical therapy doesn't mean your physical therapy is over. It just means that your physical therapy at that particular facility is over. So it's important to ask the question, what am I supposed to be doing at home? If the test is recommended, why is this test recommended and how is it going to help? This has been a big deal over the last 10 years or so. When MRIs were developed, we used an MRI to look at everybody. It was just an easy diagnostic tool, and it was readily available. And somebody was complaining about neck pain, shoulder pain, back pain. So we would take an MRI. And what we found is that we found a lot of things on MRI that did not correlate with symptoms. So just because it's there doesn't mean that treatment is needed for it. If you came in with back pain at one level and we found back condition at another level, it doesn't mean that they're related. And so we have stopped ordering quite so many diagnostic imaging. My question is, if this test is positive, are we going to change the treatment plan? If we're not going to change the treatment plan, then there's really no need to have the test. Back in the good old days, before we had all of this technology, doctors actually put their hands on you and did very in-depth physical examinations. They had to rely on what they could see or smell or feel or touch or move. Those kinds of things have changed because of the advent of all this technology. And some of our newer doctors are not used to putting hands on patients, and they don't do all of the actual diagnosing that they used to. You also want to know if the treatment is based on the latest medical studies and evidence. There are guidelines that are put out that tell you what you should do, step 1, step 2, step 3 in this particular condition. And not all physicians follow those recommended guidelines. Sometimes it's appropriate to bypass the guidelines, but it's important to know when a doctor is bypassing the guidelines and what the reasoning for that is. On procedures, I spoke a little bit about that. Why do I need it? What's it going to do? How's it going to help me? What's it going to cost? And is my insurance going to cover it? Is there any other options before doing this? For example, I'll go back to my shoulder. I didn't want to have surgery. So there was no reason in having an MRI to tell me that I did or did not have a tear if I wasn't going to have surgery. So what kind of treatment options were there? I used every kind of conservative treatment there was that was available to me in an attempt to avoid surgery. The same questions go on whether a doctor is making a diagnosis or prescribing medications or recommending treatment plans. And the overall goal is to make sure that we don't have any medical errors. This happens all too often. So many times we have medical errors and we don't even recognize it. I do a lot of legal work, and some of the things that I have to do is after an injury has occurred, I go back and look at the medical records. Oftentimes, I find additional errors that took place that didn't cause any damage necessarily, but they were things that took place that we found in the records in hindsight. These happen all too often. If you had told me that when I was first in nursing school or when I was working at the bedside, I would have told you, surely not. Surely they don't happen that often. I'm here to tell you they really do. So it all boils down to being able to be a self-advocate. And I want to tell you about how to get the most from your visits, whether that's with your physician, your prosthetist, your therapist. And it really boils down to 10 major categories. Always arrive a few minutes early, but be patient. Yes, doctors often run late. It's more important that you get there and have a chance to check in, fill out any paperwork that needs to be filled out, gather your thoughts, and have a chance to go over what you're going to address at this visit or what your expectations are for this visit than it is to simply show up at the last minute frazzled and, ready to go in. You need to make a list. Make a list of the top things that you really want to discuss at this visit. Yes, your doctor told you to come back on October 27th, but now that it's October 27th, why is it that you're back? What is it that you're supposed to be addressing? What were you like last time? And how are you doing this time? What's new? What's different? Consider bringing a friend. That's that extra set of ears we talked about, or someone who can help speak up or remind you of things. Bring either all of your medications or a list. These days, your list is appropriate. There are certain physicians here locally that want you to bring in all your medications. Typically, those are pain management physicians, and everyone else is pretty good with the list. I will tell you, though, if you bring a list, to make sure that you have listed the name brand, the generic name, the dosage, how you take it, and who prescribed it. You also need to include any supplements that you take, vitamins, minerals, different things of that nature. If you take any kind of like B12 shots or anything like that, you need to list those as well. They do have some interactions, and it's important to have a complete list. I've asked you to send all of your questions in advance, write them down in advance. You should also prioritize those. Again, because our face-to-face time with our providers is so very limited, you want to make sure that you bring up your very most important questions first. If the appointment gets cut short, at least you've gotten your most pressing things out of the way. Be honest. What this is about is if the doctor asks you if you're a smoker or a drinker, admit it. If you're using illicit drugs, admit it. It's important for your provider to know it's not a judgment call on what you're doing outside of the visit. It's about whether or not the treatment plan that they recommend would be warranted in the case of someone who does use those particular devices, I should say vices, or how much. So if you're a social drinker, social drinking means a lot of different things to a lot of people. Some social drinkers drink a 6-pack every day, while other social drinkers want to drink to the point of being intoxicated every weekend. It's important that your provider knows exactly what it means if you say that you're a social drinker. Again, Speak up and ask questions. If you don't understand, make sure you ask for clarification. One of the best things that you can do in communicating with another is to parrot the information back. You say, oh, doctor, you say I need to use this medication, what, in the morning, once, every morning? Now, do I take that every day or just on the days that I feel like I need it? If you're feeling rushed or uncomfortable, let them know. A lot of times they will either provide an additional time for you, or they may have a nurse practitioner or a physician assistant who can come in and can continue to help you. And when warranted, seek a second opinion. A physician or provider who does not want you to seek a second opinion, there's something wrong. You need to run far, far away. Anyone who is confident in the treatment plan that they recommend should be open and willing to have you seek out another opinion to see if they say the same thing. Or perhaps they say something slightly different, and then you get to choose which you think is the best option for you. Keep record. A lot of times, especially these days and with telemedicine and so forth, you can ask if you can record the conversation. You have a voice recorder on most cell phones. And if you tape the visit, just ask for permission first. Most doctors don't mind, but it'd be really nice if you ask their opinion before or permission before you actually record the entire visit. Remember that communication is to be a two-way street. This is not simply your doctor barking orders at you on what you should do, but rather you voicing your concerns and what it is that you would like to have happen in your case. There was a study done by Yale that said that 80% of the patients in a hospital did not even know the name of the physician who was taking care of them. But on the flip side, the physicians thought that the patients knew their name. 50% of patients did not know the admitting diagnosis, while the vast majority of doctors thought the patients completely understood their diagnosis. So there's certainly a disconnect there. And that's why I say it's so important for us to speak up. But you don't have to do it alone. There are places to go to seek professional advocates if you do not feel like you're confident enough to do it on your own. There's a board certification for patient advocates, and there's a national foundation for patient advocates. In addition, we have the Limb Loss Resource Center where you can find peer counselors and so forth that can help. There's an enormous amount of literature available through the Amputee Coalition that can also provide guidance. Just having an extra set of ears or eyes is often all you need. But sometimes you might want to have somebody a little more in tune to this particular condition, or maybe even this provider. I'll give you another example. One of the ladies from our church was seeing a cardiologist. She had atrial fibrillation and she was recommended to undergo a cardioablation. She was very fearful of having that procedure. And even though it's standard of care, and I thought it was probably appropriate for her to undergo that, it's something that she didn't feel comfortable with. She did her own research. She found some options that she thought she was more willing to abide by, which is like a type of oral medication that you could use for a while. Yes, cardioablation was a much more streamlined, more recommended, was within the guidelines, but it's not something that she was comfortable with. So she asked me, would y'all please go to her appointment with her? And I went to the appointment and I watched the physician never make eye contact with her. I was in the room with her and he would direct his attention to me and try to talk to me. And every time he would talk to me, I would repeat what it is that she was wanting. And I would turn and I would look at her, and it would force the physician to try to turn towards her to talk to her. In the end of that appointment, he had agreed that what she wanted to do was a reasonable option, and he was willing to give it a go. When we walked out of the appointment, she began crying and she was hugging me, saying that that was the best appointment she'd ever had. And I thought, how sad was that when I didn't feel like he was giving her the time of day. I didn't feel like he was giving her enough benefit for the research that she had done or for what she wanted to do. I really thought that maybe he was not the best physician for her because he wasn't listening to her. But in the end, she felt listened to for the first time, and she was excited about going forward with the treatment plan. And good news is she was right. It worked great for her. So there are places that you can get patient advocates. I am Victoria Powell of VP Medical Consulting. I'm going to open this up for questions and answers. If there's anything in particular that you would like to know about advocacy or speaking up, I'd be happy to entertain those. And while we're waiting for the questions to come in, I just wanted to give a thank you to the sponsors of the Amputee Coalition. Without these sponsors, we cannot put on a conference each year. And so it's very important that we also give them kudos as well. I did a presentation for another agency just recently, and I thought I would share a couple of slides from this as well. There are different types of advocates, hospital-based advocates, such as social workers that are hired by the hospital. They work actually for the hospital. And there are some that are represent patients while they're on their campus. So for example, a VA center might have a patient representative office that's at the VA. They're not actually employed by the VA, but they have an office there on site. But those types of advocates work only while you're in that hospital-based system. And then you have nonprofit advocates, which would be like the Amputee Coalition, that American Cancer Society, National Patient Safety Foundation, and so forth, or you can hire private patient advocates. So where do you find them? Whoa, here we go again. Oh my goodness gracious. I wanted to show you some patient advocacy. So here's basically the whole point, is to mitigate risk. It's a way to bridge the consumer, the patient consumer, to the healthcare provider. So this is the patient advocate oh, wow. The board certification of patient advocates right here. If I can make that stop. I cannot make it stop. National Association of Healthcare Advocacy, same kind of thing. You can search by location with them. There are national associations that you can tap into as well. And they're available online, or you can contact me and I can tell you exactly how to access those individual agencies. They usually are at a cost, and the cost varies. One of the patient advocates in our office does a free consultation. You contact her, she lets you know what she can and cannot do for you. And then given the information that you share with her, sometimes she can just give you free resources and get you on your way. Other times it's a matter of actually setting up an appointment, or attending an appointment with you, or writing a letter on your behalf, or contacting a provider or someone on your behalf. And we tend to do those in flat rate fees, but not everybody does that. A lot of people do it by hourly. There are a few free patient advocate agencies. Those that are free tend to be based on a grant system. That's how they get paid. The advocates get paid through a grant system. And they are usually for a specific healthcare condition. So for example, certain cancers, certain ALS, which is also known as Lou Gehrig's disease. There's some Alzheimer's grants. So certain kinds of conditions, and that does not include amputation. I think there may be one for diabetes. If your limb loss is secondary to vascular condition, you may qualify for that. But it's through the National Healthcare Advocate Foundation, or a National Advocacy Foundation. So we have about 10 minutes, I think, if there are any questions. One thing I failed to say is that when you make your healthcare notebook, if you can find one of those multi-subject notebooks that has pockets, those pockets are really helpful to put things like test results or copies of cards, and like your insurance card and those kinds of things can go in there, and that's very helpful. Well, all right, since there are no questions, I guess I will wish everybody a good afternoon. If anything comes up, feel free to reach out to myself or to the Amputee Coalition. And we hope to see you at future webinar and continued